Hello, everybody. I'm Bob Dempsey of the UW Neurosurgery team, and I'm giving our update on COVID. As you know, I give these periodically, usually when we have new information. I thought this morning, when I came in, I thought just the way I saw people, it would be important that we stopped and talked a bit. Because it was abundantly clear to me that people were frightened, people were uncertain, and that the changes that were taking place in the last 2 weeks are really frightening people. So it's time to talk and be reassured with a message of be calm, be safe, but also be realistic. I think the big difference is that early in this 2-year pandemic, this was a very deadly disease, but a little less common. What's happening now is this disease and this variant has changed to something that is less deadly, but still makes a lot of people sick, but much easier to catch. Now our families are getting sick, our friends, our coworkers, our staff, people we rely on. We're uncertain what's going to happen. But actually, the information is there. It's playing out very much as was predicted, even in the last talk. We have to look at that, be prepared for it, deal with it, and we will get through. This morning, Dr. Brooks gave a wonderful talk about resilience, optimism, and endurance. It'll be on the website. Be worth seeing. He talks about how people become adaptable and how we learn from stress and how we deal with it. That's where we are now. Now, right now, this thing about being realistic is important. A lot of people who aren't in healthcare aren't taking this seriously. They aren't protecting themselves. That's no reason for us not to protect ourselves or our families. What we're seeing is we're really at the crucible where the sickest people from this very common infection will be coming to the hospital. And I want you to know that it's very common, but it's also very safe. Most important, if you look at it, Omicron now is probably infecting 1 in 10 people in Madison. If you were to just simply survey, as we do when people come in for elective surgery thinking they're healthy, 10% are infected. They don't even know about it, which makes it rather frightening about the possibility that the people go around not protecting themselves in normal situations. We know that testing and sick and documented cases have taken now 1 in 6 of people in Wisconsin. And those are the ones we documented well. And that's usually about half of the actual cases. So it's a very, very common thing that has taken hold of the past 2 years. And because what that means is in a disease which is 1/3 as virulent as the old variant, but 3 times more infectious, and that's what we think it is defeating slightly our vaccinations. So people are getting infected, but not very sick usually. But the odds are that with that many numbers, we're going to have people in the hospital who are immunocompromised, et cetera, and sick, and they're going to fill our beds, our ICUs, and still have deaths. So what do we do with it? Well, our problem is our staff are getting sick. And so we have a situation where the hospital is full, not only of COVID patients, we have about 50 to 70 in this hospital, an odd 100 or so in our other hospitals in our network. But that's really crucial space because other hospitals aren't able to take care of their usual cases. They send their sickest non-COVID patients here. So yes, we have been triaging patients, taking the sickest people first for weeks. You may have only been hearing about this as patients began to notice it, but it's really been true. And that's what doctors have to do always, is take care of the sickest first. And we're doing that. We're doing a very good job of it. Things will get tighter, I think, over the next couple of weeks, but I think we will get through it after that time. So yes, it is a difficult time for very elective surgery. Much of what we do in neurosurgery isn't elective, so we're very much active, working, very busy. because of all the cases that have been coming to us. And who's going to take care of them? Well, our staff are spectacular, but we need to keep everybody healthy. This is the time everybody got to be vaccinated. Everybody's got to be boosted. We know clearly that if you are vaccinated and boosted, even this very infectious variant is about 6 times less likely to infect you. And many times more, maybe 10 times more, less likely to make you very sick or hospitalized. Still, some do because it's so common. But I'd much rather throw my odds tenfold better. So be boosted, be vaccinated, no question about it. But mask, distance, these remain the key, and they're very effective. There's a reason why the hospital is so safe. We are masked. We use N95s. We use the paper masks of surgeons because those are very more effective electrostatic blockage than the cloth masks. Although some cloth masks, you can put a paper filter in them. We do not use face shields as much as we did before because we realize this is airborne and can float around the shield, but has to be filtered out by the mask. We still use shields for splash or other contamination because we are decreasing all infections. What we have to realize is that this present surge isn't all bad news. You see, this is the way pandemics die out and have throughout human history. Generally, as they mutate and change, or have infected a number of people, they begin to run out of either infectiveness or virulence or targets. And it can take different periods of time. Plague took 600 years, but the average flu is just endemic in our society. One makes a lucky mutation, it rises, makes a lot of people sick, and a few susceptible people die of flu every year. But then it mutates and dies out and drops back to endemic, just in the background. That's what most viruses do. The flu takes 3 months to do that. It's my sincere hope that this coronavirus will take 2 years and will begin to mutate itself down to just a background problem over the course of this coming year, hopefully by spring. That's my hope. And the reason is because, remember, it is at base a common cold virus that made some very unfortunate mutations. The newer ones make it more infectious, but not necessarily more virulent. So if we can decrease the actual number of infections over the next weeks, we will see a decrease. But it does make it difficult to figure out how we look after each other and what we do and what we test. So first principle, look after each other. I feel safest in the hospital. We're masked, we isolate, we separate, we test. It's really the safest place, I know. If we must go out, and we must go out into society, we cannot allow ourselves to stop being people, social people. We have to be sensible. I can tell you that it's very effective to have a N95 or a paper mask over an N95. Not easy to run or breathe like that, but we go on with our lives and try to stay healthy. And if you are healthy, that's great. If you feel symptoms, get tested, okay? And if you're positive, isolate. If you're sick, get tested, see your doctor, who will have treatments, because we have treatments, they're changing and changing constantly, which mitigate the severity of illness. That's going to be a big key in 2022 to how we keep people out of the hospital. And if they're in the hospital, we care for them. And we don't care if they were vaccinated or not vaccinated, doctors, nurses, medical people. We can feel badly about this because they could infect us, but we still take care of people, even if they make decisions we don't necessarily agree with. And so we take care of the sickest first, and we try to take care of our non-COVID patients just as actively as we would in any other situation. But we will have to do some triage, and it's going to get stricter in the next few weeks. But I believe it will break after that, just by the weight of this infection, of this not as virulent but common infection, which is sweeping through people. It is not to your advantage to catch this. It is much to your advantage to let it die out because it cannot get to people. But we have to realize we cannot vaccinate the whole world a couple times a year. I mean, this is changeable enough. Vaccines have been an important part, but there's really only a couple of illnesses, polio and smallpox, that we've kind of vaccinated far into the background or completely out of existence, like smallpox. The rest of them, we get it down to pandemics, which it does naturally, and we speed that process by masks, isolation, hand washing. So do go on with life. Do stay healthy. Do it, attend these necessary things. There'll be modifications in schooling, but schooling is going to be important. And people need to be safe and respect each other in those situations. We can't vaccinate everybody in Africa. We've tried. It's not succeeding. Mutations come. We would like them to be less and less virulent mutations. That's the natural course of a viral pandemic. So it drops back into endemic. And we try to protect people from dying or becoming hospitalized while that's happening. So testing everybody on the planet may not be the best strategy because basically we're going to find that 1 in 10 are already infected right now. It is more important, if you see how this is going to play out, watch the number of hospitalizations, the number of ICU patients, and the number of deaths. That will tell us when we're getting on top of it. That's why we're worried now. But if you look carefully, the number of cases, which are relatively mild, is huge. This is not like it was 2 years ago. 2 years ago, people were getting very sick. And now we have a less virulent disease. We know more about treating and more about avoiding. That's going to be our key. So my rules for you is take care of yourself and your loved ones. People you care about, your family, your coworkers. Be very proud and resilient of what you do, because our secret weapon is what we do is something we're very proud of that has a purpose and actually helps fight this pandemic. That's the beauty of being in healthcare, of being proud of what you do and having purpose. These are the sort of things that keep us going, that give us resilience, that have importance because we care about people. And that's the thing to highlight, not whether or not they were vaccinated. We will continue to lobby, push, teach people to be vaccinated, but we will have the endurance to get through this, the resilience to get through this. And as I said last time I gave this presentation, we will prevail. Right now, we're at the most difficult time because people are frightened because it's coming close. Family members, friends, coworkers. But they are mostly not getting seriously ill. Protect your family from getting this. Protect them if they do get this, and we will get through. So I have a great deal of faith in you. I can't thank you enough, and I'll be here, and we'll take care of these patients. Thanks so very much.